Kangaroo mother care is a simple method of caring low birth weight babies. In this modality, a mother keeps her baby in skin-to-skin contact between her naked breasts for a prolonged period. KMC provides warmth, a good nutrition, and prevents the baby from infection.
Infants of kangaroos are very small and fragile. Mother kangaroo keeps the infant in the pouch until they are strong enough to survive. Humans have learned from the kangaroo animal to take care of their small infants by keeping their small babies in skin-to-skin contact like a kangaroo does. Components of KMC include skin-to-skin contact for a prolonged period, exclusive breast milk feeding, and early discharge and follow-up. A low birth weight baby below 2000 grams is an ideal candidate for KMC. A low birth weight baby 2000 grams or above can also be given KMC. It is recommended that a normal baby who does not require any resuscitation be placed in KMC position. It is believed that it helps in maintaining normal body temperature in the baby, decreases pain and bleeding in mothers, and improves breastfeeding. KMC can be started soon after birth if the low birth weight baby is stable, and this can serve as the sole modality of care in these babies. Generally, this happens when the baby is more than 1500 grams. KMC should be continued for as long as possible, preferably for 24 hours a day for these infants. A very small baby, less than 1500 grams or so, or a sick baby has to be reasonably stable before she can be initiated on KMC. Ideally, infants should be free from any significant illness. It may take a couple of days before that level of stability is achieved. However, some babies who are otherwise stable but still requiring some oxygen or intravenous fluids can be given KMC. It is important to take care of tubing, cannula, etc. while putting the baby in KMC position. A health provider must be close by in such circumstances. Ask the mother to keep a close watch on the color of a baby that is requiring oxygen. If available, pulse oximeter can be attached to such babies to monitor oxygen saturations. The duration of KMC can be increased gradually in these situations, but one sitting should not be less than 1 hour. Normally, mothers are quite apprehensive to handle their small infants. She should be counseled to allay her fears. To start KMC, mother should be wearing a front open gown. Make sure that she removes her brassiere. Remove all the clothes of the baby except the cap and the diaper. Make sure that the diaper is not too large for the baby, covering the whole body. Place the baby in skin-to-skin contact. Mother would initially require assistance of someone to place the baby in skin-to-skin position. Make sure that the baby is placed between the naked breast in skin-to-skin contact of the mother with folded legs and hands like a frog. Make sure that head is turned to one side. The neck should be tilted backwards slightly to ensure there is no obstruction to breathing. Take a cloth sheet of approximately an arm span's length and tie it around the mother and the baby. Place the knot on the side so that it does not hurt when the mother uses a backrest. The cloth sheet should be tight enough to hold the baby in place, but not so tight that it interferes with breathing movements of the baby. Now cover the baby with the two flaps of gown. Mother and baby should be able to see each other. In this way, mother would be able to see the color of the baby. She can place her hands before the baby's nostrils and feel the breaths. Baby can be covered with an additional piece of cloth such as a blanket to provide extra warmth if required. Mother can sit comfortably in the chair. She can take her hands away from the baby without fear of dropping the baby. If needed, she can take the baby in her lap and express her milk to be fed by alternate methods. She can walk keeping baby in KMC position. She can carry out simple household work. If she wants, the mother can lie on the bed. If she wants to sleep on a bed, make sure that the head end is elevated by at least 30 degrees to prevent regurgitation of milk in the baby. Alternatively, she can use two pillows to keep the upper part of her body elevated. Twin babies can be provided KMC together at a single time. The caregiver can wear any apparel while providing KMC. The only requirement is that the apparel supports the baby well and is acceptable to the caregiver.
See how comfortable is this baby. This is perhaps the best place for this small baby. Here she can feel the warmth of the mother. She can see, smell and listen to her mother. And most importantly, she would get plenty of milk that would support her growth.
For maximum benefits, KMC should be provided for 24 hours a day and 7 days a week. This would only be possible if other relatives are also doing KMC and giving out some free time to the mother for her personal needs. In addition to mother, anyone including father, grandparents and uncle-aunt can provide KMC to baby.
जब ये पैदा हुआ था तब ये बहुत ही छोटा था और इसका स्टेबिलिटी भी नहीं था, लेकिन धीरे धीरे जब ये स्टेबल होने लगा फिर डॉक्टर ने मुझे KMC करने के लिए कहा। जिस दिन मैंने पहले KMC किया, इसको पहली बार अपने सीने से लगाया तो मुझे बहुत ही ज़्यादा अपनापन महसूस हुआ। जब ये उदास होता है या फिर रोता है, बस इसको छूने की देर होती है, हम बस इसको छूते हैं, मैं और इसके पापा दोनों ही जब भी इसको छूते हैं तब ये चुप हो जाता है और शांत हो जाता है।
जब KMC मैंने करने शुरू किया, इसका बॉडी मेरा बॉडी के साथ टच हुआ तो मैं एक अपनापन महसूस किया कि हाँ ये मेरा बेटा है। अभी तो मैं इसको घर लेके भी KMC करूँगा।
मेरी बेटी का बेटा है ये बहुत कमज़ोर था इसलिए नर्सरी में रखा गया। जब डॉक्टर ने मुझसे कहा कि इसकी KMC करनी है तो हमने जब इसको अपने सीने से लगाया तो हमें बहुत ही खुशी हुई और बहुत ही अच्छा लगा। ऐसा लगा बहुत प्रेशियस चीज़ है ये हमारी। इसको भी बहुत अच्छा लगता है और इसका वेट बढ़ता है इससे, और ये हाथ पैर भी खूब चलाता है, हमें पकड़ने की कोशिश करता है।
पहले दिन मैंने जब KMC किया तो मुझे थोड़ा अजीब लगा, डर भी लगा। फिर अगले दिन मैंने जब किया थोड़ा थोड़ा मुझे ठीक लगने लगा, एक्सपीरियंस भी आने लगा मेरे को। अगले दिन मैंने जब किया KMC तो मुझे अच्छा लगा।
Initially, KMC was thought to be an alternative to technology-based neonatal care, but actually it complements the technology. In addition to improving breast milk in the mother and weight gain in the baby, it reduces stress in the mother and the baby as well, and that's a real great help.
I am convinced that KMC is extremely useful being done by parents or grandparents in NICU or hospital. It can be done at home also. I am working in a place where there is a scarcity of beds and nurses, so it will be extremely useful by promoting breastfeeding, adequate weight gain and thereby planning for early discharge.
10 years ago, when we started Kangaroo Mother Care, it was a challenge for us. Initially, everybody was reluctant in accepting it. We felt it had increased our workload. But as we realized the benefits of this modality, it became a part and parcel of the care what we provide to our small and sick babies.
We found the KMC to be an amazing thing. Mother and their babies are so happy. and it does not cost anything.
우리 강원도 서병원에서도 피부 접촉 방역 방법을 널리 받아들이겠습니다.
Kangaroo mother care builds confidence of the mother to take care of the baby. Because of this and improved weight gain, we are actually able to send our babies home earlier.
Kangaroo mother care is a simple, humane and effective method of looking after small babies. Kangaroo mother care as a modality of care for newborn babies who are low birth weight is backed up by scientific research worldwide and a large amount of experience in all continents of the world. Kangaroo mother care provides warmth to the babies. It promotes breastfeeding of the small babies and therefore gives them the best nourishment possible. It improves the bonding between the mother and the baby, and it leads to much better weight gain in low birth weight babies. On all these counts, Kangaroo mother care in principle provides basic needs of small babies, and it is therefore eminently recommended as a part of newborn care at all levels, in all facilities, in all parts of the world.